everybody. How are you? It's a little late today because I have family FaceTime on Thursdays at 3 o'clock, so that takes priority. I hope you can forgive me for putting family over this nonsense. But it's nice to know that we've got consistency in our inconsistency, and that this swine is actually going to come out here and he's, in theory anyways, making everybody just wait as you do, I suppose. Here we go. So fun. Do I have to turn on the monitor thing for me to hear? Yeah. No, I don't. Okay, good. Yeah. And away we go. Sorry, hold on. There'll be an echo for a second.
Our nation is engaged in a historic battle against the...
Oh my God. Now we're not even doing he's not even starting with his old joke about social distancing. Your voice sounds not quite right. Please stand. Oh, it's way hot. Thank you. I'm very hot right now. Hold on. Check, check one, check two. Is this better? Is it way hot? Too hot lady. It's too hot. Gotta run for cover. Gotta run for shame. I'm too hot lady. Is that better? Why does he bring Pence with him? What if they both get sick? He brings Pence with him because Pence is actually running the task force, and so he actually is the only person who knows the real answers because he's doing this all day. His hair's back to normal. Yeah, they changed his hair color again over last night. Like, apparently that was the reviews. By the way, my hair is very fluffy in the back. I apologize. I was just showing my son his new helmet that I'm making for him. So, what's happening, Hal Bakery? How are you? Good to see you. Operation Scapegoat, yeah, is in full effect. Thank you, Galactic. Thanks, everybody, for supporting the show and all that stuff and blah, blah, blah. Piece by piece, we'll get at this. Let me know what the audio is like on this beginning thing, because I know you guys will get very upset if you can't hear him well.
Enemy.
Oh, God, Invisible Enemy. Here we go. This is by the way, Invisible Enemy is not an accident. Invisible Enemy is what they're using. Ooh, that was weird. Oh, thank you, Joe Carter. Oh, I know what that was. Hold on. Is this thing on? Oh, there we go. That's why.
To win this
Hold on. Okay, so he says Invisible Enemy. The reason he says Invisible Enemy is because you can't be blamed for not seeing it coming. How can you see an invisible enemy is on its way? How can you? I mean, anybody could have missed that. It's invisible, people. It's a little bit buzzy. Okay, it shouldn't be that loud. It should be the same as last time. I don't understand. Why, OBS, are the settings different every time I get started? What is happening? Why in the world would you do such a thing? How do you bring this down a touch? Bringing it down a touch. Oh, yes. Oh, yeah. Bringing it down a touch. Is it too much to ask for? Very weird. Because on there it's not peaking. On there it's not peaking. Everything. Is it better now? Is this okay? It seems to be on the, coming in from the thing. It's peaking out red, but I don't know. Rather hear me than Trump. Yeah. Twitter's not working. Twitter's on. Periscope should be. Oh, or is it down? Well, either way, God knows. Let me try to do this real quick, since I can. While none of us are in a huge race to hear this fool. Cool. Back out. Check, check 1, check 2. It still seems to be peaking out of there, but not quite as bad. So hopefully that's all right. Does this sound okay to you guys now? Is it spiky peaky? Is it peaky spiky? Is it spiky peaky? Sound fine? Okay, good. Excellent. I'm just chopping down these trees as they get in front of the car. That's what's happening. Anyways, so here we go. By the way, another inspirational reading from Dear Leader.
We have undertaken the greatest national mobilization since World War II.
Mm-hmm. Have you? And how well have you undertaken the greatest mobilization since World War II?
And that's exactly what it's been.
Really? That's exactly what it's been? The greatest undertaking? Oh, yeah, okay.
We've marshaled every instrument of American power, and we've unleashed our most potent weapon of all, the courage of the American people.
Oh, did you? How did you unleash the power of our courage? Just in case I need to later on. Is there a recipe? Do you guys know? Did you get it? Thank you, Rebecca. Did you guys get some sort of like space beam? Yeah, his hair was totally white yesterday.
These have been trying times.
He's got the same hairdresser as Rudy Giuliani. His hair flip-flops between white and black like no one I've ever seen.
A cruel virus from a distant land.
A cruel virus from a distant land. Shot across the bow, China. Okay, Trump's audio is a bit low. Excellent. Mission accomplished, I suppose.
Has unfairly claimed thousands of precious American lives.
Is there a fair way? Oh, I see. That's why. Hold on. No, yeah, there you go.
Every citizen who has lost a cherished loved one, your pain is our pain. We mourn as one national family. Our country has come together. We draw solace from the faith that God has received and the departed. He has taken the departed into his eternal and loving embrace.
Oh my God, he's eulogizing the dead now, and he can't even do it right. Does anybody? I mean, it sounds like he used evangelical refrigerator poetry to say that. What the shit was that?
Departed. He has taken the departed into his eternal and loving embrace. They will never be forgotten.
Yeah. You don't even know him to start with. How can you forget someone you never knew?
Over the last weeks and months, millions of Americans have joined together in a shared national sacrifice to halt the spread of this horrible disease.
Yeah. Hi, Christina. Thank you. I don't have a Patreon thing up on the page. I'm slacking already. Pitiful.
The Army built field hospitals and sports arenas and convention centers. The Army Corps of Engineers.
What? They didn't build any convention centers. Who got a new convention center in this? What city got a free convention center?
Is great.
Well, yeah, they'd have to be great if they built a convention center and no one can even see it. Secret convention centers. That's amazing.
Over 20,000 beds in record time. The Navy sailed hospital ships to our biggest cities. Life-saving supplies and experimental medicine.
They sailed them up the coast.
Were rushed to the front lines as we launched a rapid search for groundbreaking treatments and vaccines. We built.
Did you launch that? Did you really launch that? Or did everybody scramble to try and beat a disease, private and public, across the entire globe?
Most advanced and robust testing.
Oh my God.
Anywhere in the world.
Anywhere in the world. We have the most beautiful tests. Big, beautiful tests.
And we've done more testing than any country.
No. A, not per capita, and B, We also have more dead and more cases. You're welcome, because of you.
Anywhere in the world.
Yeah, anywhere in the world where they have fewer deaths and fewer cases than us.
We suspended dangerous foreign travel. We
Oh my God, dangerous foreign travel. You did not. Okay. Anybody who questions my judgment on this, follow my Twitter feed and watch the radio show this weekend. We're going to do a whole retrospective on how Delta was ahead of this president. Delta, the pet-killing airline, knew better than to fly people in from China.
leveraged
Thanks, Carl.
our industrial base to produce vast quantities of critical medical
Mass quantities? Vast quantities. Okay, I thought he went straight conehead for us.
gear and enacted a historic $2 trillion relief package.
Oh, did you? Did the administration do that? Or did the entire government do that? Is it the first bill that's gotten through 96 to nothing?
Through it all, we have seen the heroism of our doctors and nurses like never before.
Really? Look, I know that this might be the first pandemic that some of them have seen, but it's not the first infectious disease they've dealt with or infectious person with bullet wounds that they've dealt with. Why are you surprised that nurses and doctors know what they're doing and care? They would have never even thought to save people until I got here. That's true.
These are our warriors.
Oh, I thought the truckers were our warriors. Or is it we're just all warrior? That's the way I like it. All warrior, no medics, and no band.
The bravery, our truck drivers, such
The braziers of our truck drivers. Never. Hey man, you need support on the road.
bravery,
Yeah, bravery is the word you were looking for.
and food suppliers, such incredible bravery.
Such incredible bravery to supply food. You know why it's brave? Because you let this disease roll across the country, and all the red states where these plants are waited and didn't do anything. They wouldn't have to be brave to do their job if it wasn't for you. Imagine the bravery of doing a simple thing like trucking while I'm president. You could die.
And
What?
the determination and drive of our citizens. Through this unified
You're welcome.
national endeavor,
Thank you, Hal Vickery.
we have made great progress. You could really say incredible progress.
I could say it. Let's all say it together. Incredible progress. Yeah, felt good.
Our experts and scientists report that our strategy to slow the spread
Our strategy? You mean the CDC strategy? You mean the standard strategy? Like, what part of this did you invent?
saved hundreds of thousands of lives.
Yeah, and you waiting a couple of weeks cost tens of thousands of lives. You don't get credit for not doing anything.
Models predicted between 1.5 million and
If we did absolutely nothing, why is that okay?
2.2 million U.S. deaths.
Deaths.
If there was no mitigation, could
Yeah, if there was no mitigation. If there was none.
have even been higher than that.
No, that's the number without mitigation. That's when it rolls through and it kills so many people that it runs out of people to kill in the first round. That doesn't include this fall, next spring. It's going to be around for a year and a half.
And between 100,000 and 240,000 deaths with mitigation. It's looking like we will come far under even these lowest numbers.
Yeah, we will, because the whole country's staying home earlier than you said we should. And we're going to stay in longer than you say we should.
Thanks to our all-out military operation and the extraordinary devotion of our people, we believe we will.
All out military. No. This is a medical intervention. It's not a military anything. You're not shooting the virus in the face.
Experience far
Thank you,
fewer
Louis.
deaths than even the optimistic projection, but there is no such thing as an optimistic projection on.
Yeah, there is. What? Optimism is not even the word. It was so optimistic that, and thank you, Michael.
Death. One person is too many.
Apparently not, because according to Dr. Oz on Fox, we could lose 2 to 3% of school kids and it'd be cool.
Our experts say the curve has flattened and the peak in new cases is behind us nationwide. More
No, they don't.
than 850 counties, or nearly 30% of our country, have reported no new cases in the
You're not testing anyone.
last 7 days.
These are the same states that never had tests to begin with.
Because of our early and aggressive action, we have avoided the tragedy of healthcare rationing and deadly shortfalls that have befallen many other nations.
We're the richest country in the world. We should. We're still rationing PPE, still to this day.
Nations
Other states are loaning their ventilators to states that are going to need them because they listened to you.
which, wherever possible, we are helping. In America, no person who has needed a ventilator has been denied a ventilator.
No, first of all, there are 2 people on one ventilator in New York currently at several different sites. And wow, he looks awake.
We're making hundreds of thousands of ventilators.
No, you're not. You're making tens of thousands. There's going to be 100,000. You don't get to just double every number and pat yourself on the back.
Delivered thousands and thousands of ventilators to the states, and
they've sent them back and gotten their own because they were broken.
actually, it's
It's even more than what I just said. I just lied.
an incredible operation. We started with very little, and we ended with a lot.
We haven't ended. What are you talking about?
The United States has achieved a significant lower mortality rate than
Oh my God. Look at him read. Look at this business. Then the
almost all other countries. Based on the latest data, our team of experts now agrees that we can begin the next front in our war, which we are calling Opening Up America Again.
That's the front of the war. Operation Opening Up America Again. Wow, wow, wow.
And that's what we're doing.
Really? But is that the name? Do we get, or will there be Space Force hats? Please tell me there'll be Space Force hats. Open up America, America Again Council.
We're opening up our country.
Are we? Because I don't think we are. Because New York extended their shelter-in-place order till May 15th.
And we have to do that.
No, we don't have to do that. Not if it's going to kill more people than...
America wants to be open.
Yeah, we want to. So what? I want ice cream to make me tan and muscular. Who gives a shit?
Americans want to be open.
Ew. Excuse me? Open to what kind of open are we talking about? Is he hitting on me? This is weird.
As I have said for some time now, a national shutdown is
Uh-oh, they've got graphics.
not a sustainable long-term solution.
No, it's not. But it's a 2-month solution, and if you turn it into 45-day solution when it's a 2-month solution, then it's not a solution at all. It's like taking antibiotics. If you don't take the whole course, you can get sick again. It's exactly it. This is the dude bailing out 3/4 of the way. He's still got antibiotics left over in the pill. He's not going to take the rest of them, and then he's going to make a superbug. Nice work,
preserve
dummy.
the health of our citizens, we must also preserve the health and functioning of our economy.
Right, which is more important than our citizens.
Over the long haul,
I've talked to Vladimir Putin and the Prince of Saudi Arabia, and they both were worried about their investment strategies.
can't do one without the other, cannot be done. To keep vital supply chains running,
Chains? Vital supply chains.
these chains have to
Or chains. Or chain.
be taken care of so delicately. They're delicate. The balance is delicate.
Is it? And you're going to be masterfully dealing with the delicate balance?
We want to deliver food and medical supply.
But we're not going to unless we open the country and let everyone get sick.
We must have a working economy, and we want to get it back.
We do. This is the economy as it is, not as you want it to be. I don't know why that's hard for people to understand as well. Like, the fantasy version of reality that these people cling to is just maddening.
Very, very quickly. And that's
Mark,
what's going to
thanks,
happen.
Foxy Mama.
I believe.
No, it's not going to happen very, very quickly. Unless you have an antibodies test, it's going to happen very poorly.
It will boom. A prolonged lockdown combined with a forced economic depression would inflict an immense and wide-ranging toll on public health. This includes a sharp rise in drug abuse, alcohol abuse, suicide, heart disease, and many other dimensions of physical and mental well-being.
Yeah, that aren't contagious and are preventable if you don't lie to people. What? So, because people might engage in behaviors that will shorten their lives and commit suicide, we're all supposed to commit suicide on their behalf. Huh?
Moreover, many patients have put needed medical care on hold, creating entirely new hazards for public health.
No. They put on, like, unnecessary surgeries. They put them off for a few weeks. We're talking knees and stuff. Everything else you can get, you just have to schedule it around it. And one of the reasons why you're not doing it is because the place you would go to do it has a contagious disease that might kill you.
Our country has suffered. The world has suffered.
Yeah, and we're going to suffer more if you, like, I think the wolf is gone. Go outside and check. I'll stay in here by the fire.
184 other countries have
Yeah, that should give you some indication of where this disease is.
suffered.
Yeah. And the suffering is not us dialing down our lifestyles temporarily to fight this off.
Therefore, my administration is issuing new federal guidelines that will allow governors to take a phased and deliberate approach to reopening their individual states.
And if they screw up, it's on them. If your citizens die, it's up to you. This is him abdicating responsibility for all of this. That's what this is. This is this man deciding that when people die in all these states, it is not his fault. It's the fault of the governor who opens it up. They tried to put together a board of people. We'll see if he announces the names of the people on his board. Nobody wanted to be on this because whoever makes that decision is going to be responsible for the deaths. And now he's just saying, it's the governor's fault.
I've dealt with them now a long time, and we've had a
What do you mean a long time? 3 weeks? A month?
great relationship. Democrat, Republican, the relationship has been good. This strategy is based on hard, verifiable data. I want
No, it isn't. It is not. We don't have enough tests. We have no idea how many people have got the disease. We don't even know the part that would help us open the most, which is the antibody test. Who is immune to it?
thank Dr. Birx for her incredible leadership in creating
Oh yeah, and Dr. Fauci for not being here. Is he out today? We'll see.
these guidelines in consultation with scientists, experts, and medical professionals across government. Dr. Birx will explain the guidelines in more detail in a few moments. And Dr. Fauci has been absolutely terrific. We've all worked together,
Oh yeah, where is he? Is he there today?
and we've worked together
He
well.
is in. He's on the dugout bench. Okay. Is he going to get to talk or?
They are interested in the health of our country,
Me, not so much.
and we're all interested in the viability and making us truly great again.
Oh, we get to make America great again. Again, he's suddenly Scorcher from Tropic Thunder. Here we go again. Again.
We took the greatest economy
Oh my God! And we told it to stop and blah 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 blah.
in the history of the world, and we closed it in
Yeah. So the citizens wouldn't die.
order to win this war.
We stopped it and we had a great manufacturing situation and we put down everything just because the Japanese attacked and Jews were being exterminated in Germany. We were doing great. Why do we have to run overseas and protect those people?
And we're in the process of winning it now. Our approach outlines 3 phases in restoring our economic life. We are not opening all at once, but one careful step at a time.
By letting the governors just free ball it.
Some states will be able to open up
Magma.
sooner than others. Some states
Don't have a problem. They're looking at the other states and they're going, whoa, that's a problem.
are not in the kind of trouble that others are in. Now that we have passed the peak in new cases, we're starting our life again. We're starting.
We're starting our life again. I'm learning to love again. One day I'll be free and my economy will. All right. God, this is ridiculous.
Rejuvenation of our economy again.
Oh my God. I'm like writing lyrics from what he's actually going to say in the future.
In a safe and structured and very responsible fashion.
Based on what?
Our strategy will continue to protect senior citizens and other vulnerable populations while allowing military and other groups of incredibly talented
Wait, he didn't mean to say military. What did he's winging this sentence because he missed something.
people to go about their real business and the business that's supposed to be hard at work at doing, and nobody does it better. Our military.
Nobody does. What better? What military and so many other people who are doing the things that they are supposed to. What was that? Wait, 1 second. I need to hear that again because that was glorious.
Incredibly talented people to go about their real business and the business that's supposed to be hard at work at doing, and nobody does it better. Our military.
All right, I got that. You guys got that? What?
Is the greatest anywhere in the world.
And they're supposed to be killing people, not helping people. This is bullshit right here. This, this is amazing. I like.
And we're so thankful for what they've done. Healthy Americans
Don't need to be shot, unfortunately.
will now be able to return to work as conditions on the ground allow. Instead of a blanket shutdown, We will pursue a focus on sheltering the highest risk individuals, so important.
Yeah, 1 in 9 people. How do you know who? How do you know who? What are you basing the highest risk people on? Now that the disease is the 2,500 people who have it in every state, which means 25,000 people. So who are they? You're not testing enough people. What the shit are you talking about? Oh, I think my food is here.
We're establishing clear scientific
We're establishing Shabbos.
metric and benchmarks on testing, new case growth and hospital capacity that must be met before advancing to each phase. And that's each phase specifically.
As opposed to generally phases. I've got these soft, fuzzy phases I would like to do.
In the reopening of our country. This is a gradual process as the
Oh yeah, how gradual?
caseload in a state continues to go down, restrictions can continue to be eased and come off. Throughout the process, citizens will continue to be called upon to use all of their weapons in this war, vigorous hygiene.
Vigorous hygiene. Rambo, you going into battle with just a bow and arrow and a knife? No, sir. I also wash my hands.
Teleworking when possible, staying at home if you feel sick, maintaining social distance, sanitizing commonly used surfaces.
You mean all the shit I was telling everybody to do in December when you were golfing?
And being highly conscious of their surroundings.
Oh, yeah? You'll have to excuse me. I have to be highly conscious of my surroundings. What's that? Oh.
Those are our weapons.
How am I supposed to do this show if I have to be highly conscious of my surroundings? You know how much shit is in this room? It's amazing.
They're very powerful weapons indeed.
Yes, very powerful weapons. Who needs a rifle when we could just send people in with hand sanitizer to battle?
Governors will be empowered to tailor an approach that meets the diverse circumstances of their own states.
Uh-huh. It's not his fault.
Every state is very different. They're all beautiful. We love them all, but they're very, very different.
You know, you're not supposed to say you have a favorite child, but I like the dumb ones.
If they need to remain closed, we will allow them to do that. And if they believe it is time to reopen, we will provide them the freedom and guidance to accomplish that task, and very, very quickly, depending on what they want to do.
And if their citizens start dying, it'll be their fault, not mine.
We are also encouraging states to work together to harmonize their...
I have food coming in, so I'm going to be eating while this goes on partially. So if I get stuff all over my buttons here, it's Summer's fault.
regional efforts.
I mean, like, this is the day, you know those statements where they always go, this is the day that Donald Trump became president, you know? This is the day he stopped officially. This is a man abdicating power. 2 days after, I have total authority, do whatever I want, and, you know, but 2 days later, you do what you want, I'm out.
We'll have numerous cases where states have worked and will be working very, very closely together.
Yeah, without you. States are forming consortiums. Again, this goes to my whole point of, like, if you've got 50 states, why are you having all 50 of them on a friggin' call? What is that? Group them in 6.
As we reopen, we know...
As they reopen, you mean? And, yeah. Summer, we got sushi burritos from the place. This is what it looks like. Look at that. It's, this one's from Soho Burritos. It's called the Three Amigos. That's why I get it. So, yeah. It's true. It is. It really is.
that there will be continued hardships and challenges ahead. Our goal will be to quickly identify and address any outbreaks and put them out rapidly.
Oh, yeah? How? You don't... Oh, he seems wide... Boy...
una vaca solo.
If the
Rapidly. So, he said it. So it must be true.
virus returns in the fall, as some scientists think it may,
May, possibly, but I don't think so.
possibly,
Possibly. Who knows? It might come back in the fall, but probably not. And by then, we'll have forgotten about it, and I'll have moved on to try to scuttle the election.
these guidelines will ensure that our country is up and running so that we can likewise put it out quickly.
Ew. Oh, put it out. I thought he said pull it out.
At the heart of our strategy is the vital role of medical research, especially for therapies that will significantly improve outcomes for high-risk patients and reduce
He's never seen any of this shit, and he's been talking about it for weeks. Honest to God. Yeah, reported cases, exactly. You have no idea how many people are sick in the country. No idea at all.
the need for urgent care. This
Like an urgent care facility, for example.
will be tremendously valuable in allowing life to eventually return to normal.
Well,
At least 35 clinical trials are already
Flankdoodle, that's awesome.
underway, including antiviral therapies, immune therapies, and blood therapies in the form of convalescent plasma. You've all heard about some of these events, and
We've heard about all of them at least 8 times each. Oh, thanks, Michelle. $9.99 and it's 25. Okay, are we stacking? I don't know what that.
some of these therapies, they've come a long way.
No, they haven't. It's been a week. The convalescent plasma's been around forever. Oh, Jesus.
What's been done in the last 4 weeks is incredible.
Yeah, guys, you might have to re-click the bell below because I'm getting shadow banned on YouTube.
We will also
For this.
continue to expand our testing capacity. We have now completed more than 3.5 million tests.
Yeah, what million? Why is gesturing on 3.5 million tests in a country of 324 million people a big deal? By the way, they're not antibody tests.
Far the most anywhere in the world. Areas of our
No, not per capita, not even close.
country that have been hotspots have done much more testing.
Yeah, you mean New York without any help from you? The states can do whatever testing they want, but I want credit for the testing.
On a per capita basis than South Korea. We've done more than South Korea, and South Korea's done a good job.
Well, they flattened their curve 2 weeks ago.
We've done more.
They handled it earlier.
We will
What?
continue to work
A lot.
with governors to advise them on how to conduct both surveillance and diagnostic testing.
Yeah, how are you going to do it? Good luck. Is that how it works? What's the phone call like? Do your worst. I can tell you. All I know is get your strip clubs open. Thank you, Dark Fae.
Now distributed over 600,000 Abbott ID Now point of care diagnostic tests.
Yeah, that take 15 minutes. You can't even do the staff of the hospital. We've been over this.
These are tests that are
Please tell us about them, how they work. Please tell us again.
done on site, and within 5 minutes, you know the answer,
15 minutes. The 5-minute test isn't out yet.
positive or negative.
Uh-uh.
In recent days, we have seen a dramatic increase in the number of tests performed by hospitals and academic
Why wouldn't you? Seriously, why wouldn't you? Compared to January, we're doing an astronomical number of tests. We weren't doing 3 million tests in January. Yeah, you weren't doing anything then.
institutions with more than 120,000 tests recently reported in a single day.
Yeah, and they're going to have to do them again. There's no antibody test.
Far more than any country in the world has ever been able to do.
They already flattened their curve because they mitigated and they isolated and they traced. We didn't. That's why we have to test so many people. And tomorrow you can test them all again.
And our numbers are actually going up.
No, they're not. They're going down.
As
Testing numbers have gone down. They're running out of tests. They don't have enough swabs. There's not enough chemicals that they need to run the tests. Bullshit.
these new and better testing solutions come online, we're seeing this additional capacity reflected in the numbers.
No, we're not.
For this reason, the number of tests processed in commercial laboratories has dropped from approximately 100,000 to roughly 75,000.
Oh, this is this is their excuse for why the number's low, or why it's going down. Oh, let's hear this.
Tests over the last week. The reason it dropped is because we have so many other tests and we don't even have to go through the laboratories. But the laboratories have tremendous additional capacity.
What? What? How? What? Okay, so the reason the testing has gone down is because they don't need the labs to do the testing because we have other ways of testing. So he thinks these 6,000 15-minute tests are taking the brunt of the testing that's going on in the country, and at the same time, they're not counting the ones from those machines. It's about the volume of human beings, dummy. Like literally moving away from mass testing to these 15-minute machines is why the number is going down, and the lack of resources. This is just nonsense.
And states
Please do the math for us, champ.
feel free to use that capacity.
Oh, do they? Oh, good. It's not us. We're not the reason that testing is down. It's the states are failing to test.
Some in the media falsely reported this as a bad thing,
It is a bad thing. The testing is going down.
when in fact it is a great thing,
Oh, yeah? Explain why it's a great thing.
because it indicates that the states are moving to faster, more local testing solutions, including on-the-spot tests.
No. They count the on-the-spot testing. Why do you think that's not... Why does he think they're not... Those are secret machines in...
So this drop in the utilization of commercial laboratories is an affirmation that testing, which is at an all-time high,
No.
is growing at a historic rate.
No, it's not. What?
In other words, the laboratories are
Look, you don't understand, okay? The reason I say that swimming is more popular than ever, even though no one is in the swimming pool, is because more people are taking baths. And we know this because there's a tub in every home. And so swimming is the rage because more people are taking baths. How do you know they're taking baths? Because they have the tub. That's not swimming, and they're getting wet. That's all I know.
great.
Showers count as swimming, okay? Therefore, I'm an Olympic gold medalist swimmer.
But now we have forms
No one showers faster than me, and therefore,
of testing that are much quicker, much better, and we don't
why does he think they're not counting those tests?
have to use the laboratories, but they're
What?
there.
We don't have to use the laboratories anymore. So we don't even, it doesn't matter that they're out of the chemicals necessary to do mass testing. What?
They have a great capacity to do the work.
Well, then why aren't they doing it? If they have great capacity and most of the capacity is moving to these single tests, that means there's space freed up at the labs. So why are we not conducting even more tests? We wanted to, nurses and doctors can eat shit, but we wanted to make sure the people at pharmaceutical companies and lab techs are getting a nap. What?
As Dr. Birx has been advising our governors for weeks, we continue
Oh my God! So he's going to lay this out on Birx.
to have an excess testing capacity of 1 million tests per week available for use, and our capabilities are growing every single day.
What? Oh, wait a minute. We have 1 million tests we're not using per week? We're sick of testing. After all, we're maxed out on testing. They have no idea how many people have it.
Especially with the new tests that are coming onto the market
They're not they're not coming onto the market. We don't have them yet. Where are they?
rapidly. As we begin
This is just unbelievable bullshit.
a science-based reopening, we must be extra vigilant in blocking the foreign entry of the virus from abroad.
What's her name?
Border control, travel restrictions, and other limitations on entry are more important than ever to keep the virus in check and allow Americans
Oh my God. Hammer thinks everything is a nail.
to get back to work.
Is confused by screws and bolts. So we're just going to keep travel from China down? So what, how many people can come in from China? 30,000, 50,000? You're going to keep your temporary ban online that only stops non-citizens and people with new visas?
The sacrifices our citizens have made in this time of crisis will be remembered, studied, honored, and praised for generations to come.
Studied, honored, and praised for generations to come. Listen to this man. I mean, I'm almost in awe of the ego here. I mean, it's phony and it's written on paper for him, and he actually hates himself and he can't stand his own reflection and is angry every time he looks in a mirror, which is the most endearing thing about him. But I mean, that's straight out of Stephen Miller's stuff. When I write my version of Mein Kampf, this is a man who's excited by life.
We're really all working together.
Are we? Because it sounds like you're telling the governors to go fuck themselves.
Democrat, Republican, conservative, liberal, we're all working together.
To circumvent the lack of leadership in the White House. That's true. Hello to my conservative brothers and sisters out there. Wash your hands, clean common surfaces, practice social distancing. I don't want you to die. We can argue about shit later. I don't know what you thought you were doing. I mean, this is ridiculous. This is ridiculous.
This is not about parties. This is about our country.
Yeah, he's united the country against him.
Now the American people are ready to
I found the common enemy. It is not the virus. It is me.
rise to the occasion once again. They are ready to show the world once more that Americans can defeat any challenger. Together we will
Any challenge. Challenger sounds like it's a being. You know, like Putin.
build this land that we love. We will reclaim
We love it, you know. We love it. Love, so, you know.
magnificent destiny that we share, and we will carry our nation forward to new heights of greatness and glory. I would now like to ask Vice President Mike Pence
You needed to read that off the paper?
and Dr. Birx to further explain the new guidelines. I want to thank Dr. Birx. I want to thank Dr. Fauci, and I want to thank really especially a man who has devoted 24 hours a day to his task force and done such an incredible job. Our great
You're going to give him a key? Does he get a key? Please tell me he gets a key. He deserves a key, if anybody does.
Mike Pence, please, Mike.
Jesus Christ, look at that man. He knows this is bullshit. He's insisting on this. This is guidelines opening up America.
Thank you, Mr. President.
Again. Opening up America again. Again. Look at I mean, not an inspiring title. I mean, it's nowhere near Operation Farting Eagle.
The Members of the White House Coronavirus Task Force today joined
Would like to congratulate the president on his grand opening. Where's the big scissors?
the President to meet with a bipartisan group of members of the House and of the Senate to get their counsel on the development of what the President unveiled to
Yeah? What's Tom Cotton say about this?
America's governors this afternoon.
Yeah. Operation
The new guidelines for opening up America again
Opening Up America Again.
are a product of the best science
And the best advertising minds. I mean, we got the best minds on Wall Street to go, give us a catchy slogan, something that really inspire people to get back out there and work themselves to death.
and the best common sense that the President has marshaled on this team
You sure you want to be on the stage still, Trump?
and from a broad range of advisors from all across the nation. From the moment President Trump established the White House Coronavirus Task Force,
Which one? The first one or this one, the third one?
early on, he made it clear that
You guys are only going to get a quarter of the money that you need to actually do this right. Remember when he said that? Remember when Navarro was saying we're going to need $4 billion, and he's like, you can use one out of the budget that's already there. P.S. I still want to cut 15% out of the CDC's budget.
we have no higher priority than the health and safety of the American people.
Well, it's a close second to the economy.
The President launched a whole of government approach.
Oh, and that was enjoyable. I was happy to be that whole.
And while we stand here on this day, with more than 640,000 Americans having contracted the coronavirus,
The president wants me to come out here and throw myself under the
and
bus.
our hearts go out to the families of the more than 31,000 Americans who lost their lives and those who continue to struggle with serious consequences of the coronavirus.
Yeah, because some people make it through and quote unquote recover, but are missing a chunk of their lung forever. Yeah. But they're happy. Some of these governors are so happy.
The truth is that because of the decisive action that our president took early on, suspending travel from China and thereafter from
All right, God damn it. Every time I try to take a bite, I just know this is it's gonna be impossible. Delta Airlines beat him to it.
portions of
Is Trump on a giant hanger? Yeah, he looks like he's been hung there like a bully hung him on a string. Ooh.
Europe and South Korea,
Every time he pulls his lapel, that means he farted, by the way, just so you know.
screening passengers because of
It's a tick. It's a tick.
strong actions in partnership with
He keeps reading Mike's papers. How come he never looks at his paper? That's what he's saying, what's on the paper, but he hardly ever looks down at it. It like, literally, it's like Trump being with somebody who's like, can't watch the movie because they're reading the subtitles.
every governor across America because of the extraordinary efforts of America's healthcare workers
By the way, great camera work, White House.
on the front lines, and because of the cooperation of the American people and God's grace. We are slowing the spread. We are flattening the curve. We have preserved the capacity of our healthcare system, and we've protected the most vulnerable. In a word, because of the actions of this president, this administration, governors at every level, our healthcare workers, and our fellow Americans, we've saved lives, and every American should be comforted by that. And we can see it in the numbers. In the charts that I'll present today, these three maps track influenza-like illness, which in this instance
They also have my chat on them, just so you know.
is mostly coronavirus across
How did he do that? Straight up Tony Stark over here.
America. The first map reflects
Oh my God, his chat room is torturing Trump right now. What are those people saying? Put them on a no-fly list.
the total number of cases on the week ending March the 28th. The next map reflects our
They're all in Kansas. You can tell it's coming right out of the middle of Kansas.
data about the total number of cases on the week ending April 4th. And we stand here today with the final map reflecting the total number of cases across America as of April the 11th. With these trends underway, President Trump tasked the White House coronavirus.
No, that's ridiculous. You can't use the flu as the reason you open the country. The flu has a distinct set of symptoms. This disease, you can be asymptomatic entirely and pass it on. This is not the map of this disease. What the shit are you talking about?
Task force to develop new guidelines for opening up America again.
You
These
jackass.
guidelines were presented today first to our nation's governors. And it is our intention, at the President's direction, to provide these guidelines to assist governors and state health officials in evaluating the most responsible manner to reopen the economies of their states at a time and manner of their choosing. The guidelines, as Americans who are looking on will note, begin with what is the best criteria that our experts have developed. A
Here it is.
downward trajectory in cases over a 14-day period of time, ensuring that states have proper capacity in their healthcare facilities.
Okay, I'm being
The
just a jerk.
second set of proposals includes a description of recommendations for state preparedness. And let me say to the American people what President Trump made clear to our governors today, that our administration will continue to work day in and day out through our task force, through FEMA, to ensure that our states
Honest to
have
God.
not only the medical supplies, but that we continue to rapidly expand testing
No, you're not rapidly expanding testing. Testing is going down. This is ridiculous.
across the nation. The President reflected on the progress we've made on testing, but a few statistics for that as well, which I hope are an encouragement to the American people.
They won't be because they're coming from you and there's no reason to trust you.
On March 11th, we had performed a total of 23,588 tests.
Right?
Because of the public-private partnership that President Trump initiated with commercial labs across the country, that
That no other president would initiate. I mean, Jimmy Carter would have told them to go fuck themselves and hid in a bunker.
number was 83,500 by March 18th. And as the President just said, that number is 3.5 million today.
Yeah, what's the population of New York City?
It is our expectation that we will have tested more than 5 million Americans before the end of the month of April,
You mean fewer than LA County?
and we'll continue to scale those resources. So testing and
And it's a contagious disease they can catch after they've had a test?
medical supplies will continue to be an ongoing partnership with our states, and we want our healthcare workers and people all across the country to know of our commitment to that.
Why? What would make you think we have a commitment to that? What's the standard you're using as a basis for that assertion? What's happening? Why in the world?
Finally, the President directed us to propose a phased approach to reopening our economy. It is based on up-to-date data and readiness. We'll continue to provide the very best data to our states, working with their health officials.
Yeah. You know why we're doing this? You know what this is? You know what this is? Yeah, right. He did say 4 million tests would already be performed weeks ago. We're only like, if he was right about the 4 million when he said the 4 million, we'd have 20 million tests right now at this arc of growth.
The focus is on the mitigation of any risk of resurgence or the emergence of the coronavirus in states where it's not yet emerged.
It has emerged in every state.
There's a focus in the President's new guidelines
He farted again. You see that? See the coat flap?
on the most vulnerable. And we made this very clear to the
Who's the most vulnerable? Explain to me. Tell me who.
governors today. These new guidelines for opening up America again can be implemented on a statewide basis or on a county-by-county basis. With that, I'm happy to turn it over to Dr. Deborah Birx, and if I may, Mr. President, I'd like to also extend my admiration and appreciation
They are already out the door.
to Dr. Birx Dr. Fauci and every member of our task force that
Remember this date in May 15th, when New York finally starts to feel like they can start strategizing for 2 weeks after that.
worked around the clock to develop these recommendations for opening up America, where I know every American is grateful for your leadership and
No. Why?
for theirs. Deborah?
Thank you, Mr. President, Mr. Vice President.
And today I'm wearing, it's the return of the sunshine scarf. You'll recall it from day 3 when we were painting an abnormally rosy picture of the future. I'm wearing that again as a resurgence. However, I am dressed as death from the neck down.
We're going to go through these quickly because I know
Because my scythe is being sharpened and I need to pick it up.
you have them, and many of you have already
Why is he facing the wrong direction now? Pence, turn around.
spoken to them
Nice.
on television. Next slide, please.
Oh my, it's the first time he's seen these?
This is a very important slide. It talks about the gatekeeping, on the gatekeeping criteria to moving into phase 1. It's very much related.
Oh my God, the fact that they are using, quote, influenza-like illnesses as the trajectory for this is frigging embarrassing.
To what you just saw about influenza-like illness. And the United States has been tracking influenza-like illnesses through the Centers of the Disease Control.
The Centers of the Disease Control. By the way, guys, Centers for Disease Control only does one disease now. I don't know if you know that. Yeah. It's 4th stage syphilis. It's the one that was most important to the president.
For years. Both the state and public health officials are used to watching this. County health officials are used to watching it. And frankly, every family around the United States knows how to access this on the CDC website.
Oh, do we? Guys, do you know how to access the flu-like symptoms tracking site on the CDC's website? I mean, what kind of citizen are you if you don't know how to do that? You lazy bastard. How dare you? How dare you not be up on how to track the spread of flu-like symptoms on the CDC's website?
In order to get up-to-date information to the communities. It also looks at a syndromic emergency room type visits, again, housed at the CDC, and really is our surveillance program that can be utilized for a lot of different illnesses, but in this case will be utilized for respiratory diseases. In addition, we are tracking.
By the way, double your vitamin D for the time being. That's what I've heard. We'll talk about Dr. John Campbell after this is over.
The number of cases, and it must have a downward trajectory for 14 days, as well as the influenza-like illness and the syndromic illnesses. And a downward.
Syndromic illnesses. Excuse me. You okay? Yeah, I think I have a syndromic illness. How do you know? Oh, I know where to go on the CDC website to check.
Trajectory in the
Eat shit, WebMD.
number of positive tests with persistence of high levels of testing. For the hospital.
What was that? Persistence of high levels of testing? If the hospitals have robust testing programs in place for at-risk healthcare workers, including emergency antibody testing. Yeah, we don't have that. Satisfied before proceeding to phased opening. Downward trajectory of positive tests as a percentage of total tests within a 14-day period. Flat or increasing volume of tests. Well, we're not increasing the volume of tests, so if it's flat, you can maintain an artificial flat test simply by guaranteeing the same number of tests. Yeah, I'm taking 10,000 IUs. Just so you know.
It's to ensure that we can treat all patients without resorting to any crisis care, and ensuring that there's a robust testing program in place for at-risk healthcare workers, including frontline responders with their emerging antibody tests.
We, just for the record, we're not going to meet any of these standards in the next 14 days. I did. I took 10,000 IUDs.
Next slide. Now, just to show you what this looks
I collect them. It's really weird.
like. So what the CDC did for me under the direction of Bob Redfield was to chart the syndromic illnesses were reporting throughout the early part of March. And you can see in New Orleans, respiratory diseases were starting to be seen in the emergency room. That is the red line. The cases are shown in the dark blue line. The gray mountain is testing, and underneath that is the blue mountain of positives. And you can see that the early alert was present from the emergency room about early respiratory disease.
You've stopped testing, though. What you're seeing here, in this test right here, like this thing, you're seeing the natural arc of influenza coming out of winter into warmer weather, and then you're seeing the spike in hospitalizations and then the lack of testing available to prove that those people are COVID.
You can see it
Unrelated.
predated the cases. So throughout the summer, when we do not have flu to contaminate this picture, we'll be able to follow this syndromic pattern, city by city, county by county, community by community, state by state. Next slide.
Next slide. Next slide!
In addition, the CDC has the influenza-like illness net distributed throughout the United States.
This is not an influenza-like illness. It is the massive aspect of this disease. What makes it specifically different is its lack of, it's the multitude of asymptomatic carriers.
It's very useful in the winter.
No, it isn't. It is completely useless. There are no asymptomatic flu carriers.
Time. That first peak is influenza B in the
There are no asymptomatic flu carriers.
red. That's this season. I showed you all the seasons here, so you could see the seasons as they are displayed.
Oh, the seasons. One of them matches my scarf. It's
The
wonderful.
first peak is influenza
It's
B,
wonderful.
second peak influenza A, and then you can see the coronavirus, and you can see its decline, and it's declining towards baseline. This will allow us, again, city by city, community by community,
U.S. Outpatient Influenza Illness Surveillance Network tracking that for the... No.
state by state, to look for variations in an early response mode in those localities that I described. Next slide. So hopefully you see that we've brought CDC.
Nice graphics. Really well done. I like how plans is kind of pushing up into ability. Whatever. Your tax dollars at work. The best people. Look at the type size on this. You're going to... I guess you're just passing these out?
And their amazing talent of individuals at
Who are able to do these graphics?
the Center for Disease Control and Prevention, and all of their abilities to this response and also to the surveillance that we need in this response. But I want to call your attention to the third bullet on this.
Yeah, excellent point, by the way. A lot of the influenza tracking that we normally do is way down right now because if you have the flu, you're staying at home because you don't want to, if you've already got a respiratory infection, go to a place where you might get a respiratory infection.
Graphic. So we're tracking those two pieces that I described.
Is there a 1-800-FEVER?
But the third bullet is about setting up sentinel surveillance sites.
Uh-oh, Sentinel surveillance sites. Boston Dynamics dogs are coming for us. They're going to roll in and check our temperature. Thank you, Deshaun.
To be able to distinguish and find asymptomatic individuals. Individuals that you've heard about that may be either pre-symptomatic or asymptomatic throughout their entire disease course.
Uh-huh.
We want to be able to find them in communities of particular vulnerability.
How?
So we'll be doing sentinel surveillance throughout nursing homes, throughout
Sentinel surveillance throughout nursing homes. They're asymptomatic.
inner city federal clinics, throughout indigenous populations, to really be able to find early alerts of asymptomatic individuals in the community and both
You don't have enough tests to do this. And the person could have it the very next day.
for the syndromic cases that are tested, the influenza-like cases, and the asymptomatic cases, doing contact tracing, again with support from the Centers for Disease Control, working with each state and local government.
So basically, the kind of tracking and tracing that red states refuse to do because they think it's a UN New World Order plot.
In addition, we want to make sure that
So they'll lie or not show up or hide their symptoms.
all the healthcare facilities have adequate personal protective devices and the equipment to handle the surge, and to ensure the ICUs can handle increased capacity. We want every state to have a plan for the health and safety of its workers in critical industries, and to protect the health and safety of those living in high-risk facilities, including senior care facilities, as we discussed with sentinel surveillance, but also additional surveillance. When we talked with all of the states that had not had a major metro outbreak, there's
Thank you so much, Lewis. I realized I stacked the chat with that, so my bad. I'll move this over here, over my head where it's full of love for you guys. This is an incredible amount of bullshit.
sentinel surveillance is picked up always the first cases in nursing homes. And so this is a very much a big focus of the plan moving forward. I won't go into the rest of the details on this slide, but there's
Yeah, okay, let's go into it real quick. Ability to quickly set up safe and efficient screening and testing sites for symptomatic individuals and trace contacts of COVID plus results. Don't have that. Ability to test syndromic, ILI indicated, influenza-like illness, indicated persons for COVID and trace contacts of COVID results. Why? Asymptomatic carriage is the hallmark of this disease. Ensure sentinel surveillance sites are screening for asymptomatic cases, just random drunk driving tests that they set up outside of places where people who are particularly vulnerable are. Meanwhile, there's 9% of people who get ill from this who have no secondary illnesses. 1 in 10 of the people who will die from this have no extra illnesses.
a bit of details.
Lured into a false sense of security much? Oh, healthcare capacity. Ability to quickly and independently supply sufficient personal protective equipment and critical medical equipment to handle dramatic surge in need. Don't have that. Ability to surge ICU capacity. Don't have that. We have the ability to do it. Are we doing it? Will we do it? There's ability and then there's responsibility. Protect the health and safety of workers in critical industries. Can't do that yet. Protect the health and safety of those living and working in high-risk facilities. Can't do that yet. Protect employees and users of mass transit. Can't do that yet. Advise citizens regarding protocols for social distancing and face coverings. Already done that. Everybody's doing that. The WHO was doing that. I was doing that in December. Monitor conditions and immediately take steps to limit and mitigate any rebounds. You're not even ready for the one that's happening now.
On the expectations of every state and local government. Next slide. You'll recognize this slide. Next slide, please.
Next slide! Frau Farbissina.
You'll recognize this slide. It's what we've been talking about in the 15 and 30 days to prevent the spread. It's continuing those critical hand washing or sanitizers, not avoiding touching your face at all times, disinfecting surfaces,
all times.
using face covering while in public, following state and local guidelines, and critically
Wait, how's talking with your mouth full? Is that okay?
staying home if you are sick. I know a lot of people go to the workplace when they are feeling ill.
Guess what? These are flu guidelines. The problem with this disease is asymptomatic carry, you morons. Next slide!
When you're feeling ill, it won't
Did it get weird, Mama?
get better by going to work. So we're asking again for people to stay home when they're sick. Next slide is for employers to ensure that there can be social distancing and protective equipment, temperature checks, use of disinfectant in high traffic areas, including break rooms, and ensuring that we don't do, there's no non-essential business travel, and then monitoring for any symptomatic individuals in the workplace. And again, if you become ill at work, to immediately to go home. And ensure that there's contact tracing of all the individuals that become sick. I'm going to go through the phases very quickly, but you have the details. Phase 1. Again, you have to go through
God.
those gating criteria.
Great color choice, everybody. Jesus Christ. This is like the opening of the elevator in The Shining. Phase 1. Blood.
related
There will be convalescent plasma.
to 14 days of decreasing
Christ.
evidence of illness and decreasing testing despite adequate testing. So phase 1 begins with all vulnerable individuals, including those with comorbidities, continuing to shelter in place, and ensuring that those that first go out into the public are not those that are most vulnerable to bad outcomes in this disease. And then ensuring that we continue to do 6 feet maximum physical distancing in public spaces, continuing to avoid large gatherings, and all non-essential travel. For the employers, next slide. Again, if a vulnerable population needs to return to work and cannot be teleworking, there should be special accommodations for all vulnerable populations, as well as options for teleworking. We believe every employee should encourage
so-
work return in phases.
By the way, what if you're a, say, live performer, or you work at a live performance venue, or you do events, or you have, I don't know, a casino or a theater, or you're in Cirque du Soleil for...
20% or 25%
How do you telework Cirque du Soleil?
to 40% to
And now we go to Jacques jumping on his bed.
50%. And again, minimize all non-essential travel. Phase 1 continued. Next slide. If the schools are already closed, they should remain closed. All visits to senior living facilities and hospitals should continue to be prohibited. Large venues, including sit-down dining, can only be operated under strict physical distancing protocols and maintaining those 6 feet. Gyms could open if they, again, could adhere to strict physical distancing, and elective surgeries can resume on an outpatient basis. Phase 2. Next slide.
We're in the blue zone. We're using like traffic light colors, but better. So we're going red, blue, white. See what I'm saying? Red is most important. Blue is the mitigating, I guess, step, something like that. And then white is obviously the best.
Again, you have to go through the criteria again of a continuation of another 14-day decline among those criterias that were in the gating. Again, we're asking for all vulnerable
And each of these phases is 3 hours long.
individuals shelter in place. We did not put a timeline on any.
Well, gyms, interestingly enough, are one of the places where I'm surprised they didn't fold it under essential work, because you can stay away from somebody who's on the machine as long as the gym's not crowded. If they have a capacity limit, for example, would be, most gyms are like that anyways. I have I belong to Planet Fitness because it's 24 hours and you can go in the middle of the night and there's nobody there. And all you got to do is clean the stuff before and after you use it, which you do anyways most of the time.
Phases. We want the governors, with the data that they have, community by community, to be setting up those timelines.
So that we
Again,
can
we're
blame
asking
them.
for the public to continue to maximize physical distance. However, we increased social settings to be able to now have 50 individuals.
Ooh, 50.
Non-essential travel
So I'm guessing the Eagles tour is off for a little
can
while.
resume. Next slide. This is for the employers. We still would like to encourage telework, and the common areas should remain closed or be physically
Bring your own tuna, Stan.
distance. All non-essential travel for employees can resume, and then again, special accommodations for vulnerable. Next slide.
Yeah, we know how this shit works. This is what Biden was talking about. This is what California's talked about. Of course, this is how it's going to work. We know how it's going to work. The when is the question, and this asshole wants to start it up like today.
This should be a relief to many of households that have small children. Schools, daycares, and camps can reopen in phase 2. Visits to senior living facilities, however, should remain in hospitals prohibited. Large venues can operate, but solely under moderate physical distancing, and elective surgeries can resume on an outpatient and inpatient basis. Phase 3. And so phase 3, I won't go through.
Darker blue.
detail was is essentially
Yes, details. Who needs details? I mean, it's just a pandemic.
returning to our new normal with all of the what we talked about through all phases.
Phase 3 is all adults operate under a stranger danger and never get into a van, no matter how much candy they offer.
Continuing the good hygiene practices, continuing the respect for spaces between individuals, because we know that we still have an issue with
So look at this phase 3. Hold on. Vulnerable individuals can resume public interactions but should practice physical distancing. How do you know if you're vulnerable? A bunch of people don't have comorbidities. They have no idea. Does everybody need a doctor's checkup? Do you need a doctor's note? How do you know you're not carrying it to vulnerable people who don't know? All right. Low-risk population should minimize time spent in crowded environments. How long does it take to catch the disease? Resume unrestricted staffing of work sites. Unrestricted staffing of work sites. Get everybody back in there. So audiences can't go to a show, but if you got a factory where everybody's elbow to elbow, knock yourself out.
spread. I do believe with this plan that we're both confronting the issue of finding symptomatic individuals through our networks with early alert, as well as those who come and present to different hospitals and emergency room with testing and contact tracing, but critically have put in place what we believe is a safety net through asymptomatic sentinel surveillance that is centered around our most vulnerable groups between nursing homes and our Native American people and indigenous populations, and our inner city groups that we know may be in multi-generational households and of unique risk. I'll stop there, Mr. President.
Thank you very much.
Thank you. So good. That was the best. Now, Dr. Fauci, buzzkill.
Thank you very much, Mr. President, Mr. Vice President. So as you've seen just now from the detailed presentation from Dr. Birx, this is a rather robust program for re-entering into normality. There's a lot of details here, and I know it'll take a little bit of time to digest them all. So what I
No, she skipped the details. It's a 3-phased approach with broad swaths. Everybody, literally, people. This phase 1, phase 2, phase 3, if any of us sketched on a napkin what it would take after this to get people get back to normal life, just off the top of your head, this is what it would look like, right? Is there something in this that caught you off guard? Is there something in this that was like, wow, that's a detail that's an important thing I would have not realized that was so important? The only thing that stuck out to me was the flu-like symptoms tracking thing, and that's bullshit. Because asymptomatic spread is the hallmark of this disease, and that's what makes it the problem that it is.
thought would be good, since I really want to be brief to allow time for questions, is to kind of take us back to the discussions that we've had here before and why this is a natural evolution from what we had said before. You might recall that
Yeah, because this is what you're gonna do no matter what if you're confronted with this kind of a problem. This is like chess 101. This is move your pawns first kind of stuff.
on a few occasions when I was up here before you, I told you that when we get to the point where we're going to take those steps towards trying to get back to some form of normality, that it would not be a light switch that you could turn on and off.
Right.
I meant
it's
that.
it's a dimmer. We get it. Duh. No one thinks that except the president. This is them talking the president down. That's what this whole bullshit is. This charade is them talking the president down. We've got phases coming. You love talking about phases. Look at the bullshit Chinese deal.
In two different components. The first of all, that we are a very large country, and we have different dynamics in the country. We have areas of the country that have gone through a terrible ordeal, and others that fortunately have gone and gotten through this rather lightly. So that's the first thing. The second thing is that light switch on and off is the exact opposite of what you see here, which is a gradual gradation with the first thing and the only thing in mind as the health people here, my colleagues who are either physicians, scientists, or public health issues.
Wait, notice he's touching his face. Don't touch your face. Stop touching your face. What does he do?
The predominant and completely driving element that we put into this was the safety and the health of the American public.
He's telling you that this whole bullshit charade is there to talk Trump down from turning on the economy like a light switch and just letting it ride it out. Ride 'em, cowboy.
And I know there are a lot of other considerations that go into opening, considerations that you've heard of right from this podium. But the dominating drive of this was to make sure that this is done in the safest way possible. So let me just make a couple of comments to just reiterate more from a broader standpoint, the things that Dr. Birx did so well in very granular detail. First of all, in order to even consider getting into the phasing, you have to pass a hurdle. And that's the hurdle that we refer to as gating in. Now, when you think about it and look at the map of the country and look at the differences in different parts of the country, you will see that there are some regions, states, locations that are going to be almost already into some of that gating and will have already fulfilled some of those criteria. Others, because of the dynamics of the outbreak in the area, will take longer to be able to do that. But you don't get to phase one until you get through the gating. And then in order to make sure that safety and health is the dominant issue, the design of the phases were just that.
This is an intervention. That's what we're watching. This whole thing is a dog and pony show to talk Trump off the cliff of opening the country on May 1st. So he can start phases, and they can know that that drawback phase is small enough that you can rescind it.
You go into phase one, if you get no rebound, and you satisfy the gating
For 14 days.
yet again a second time, then you go to phase two. If you have no rebound and you satisfy the gating criteria for a third time, you go into phase three.
Which is June 1st.
So there are multiple checkpoints of safety
Thank you, Joe Carter.
there.
Thank you guys for the super chats today. Give us a thumbs up and a like on the channel. Hit the notification bell. I'm getting shadow bumped. Shadow bumping, taking me through the light. How?
So as I've said from
Can you
this
give some?
podium, when we were talking about the first 15 days of the mitigation, and then we extended it another 30 days,
It is literally, it's like Pence is standing there going, look, he's buying it. He's buying it. Everyone stay cool. Don't say any trigger words. And they're hoping that the press doesn't go, wait a minute, what would be the category of faith? You were talking about opening this like yesterday. Look, we have to be open. I'm going to turn it on like a light switch. Son of a bitch, we're back to square one.
essentially pleaded with the American public to say, let us make sure we do the best that we can
Thank you, Espresso
to
Strength.
accomplish that. And in fact, mitigation works. You saw the charts that the Vice President and that Dr. Birx put up. It worked. And what we hope, and I believe we will be successful, if we carefully do this, again, with the attention to the safety and health of the American public, that we will be able to, it will be staggered. Not every state, not every region is going to do it at the same time. That's clearly obvious because of the varied dynamics of the outbreak. But we feel confident that sooner or later, we will get to the point, hopefully sooner, with safety as the most important thing, to a point where we can get back to some form of normality. The one thing I liked about it that
This is, so Fauci's the blue wire, Birx is the red wire. And this is them, trying to tell the bomb diffuser how to make this thing not kill everyone.
that Dr. Birx said so well, is that no matter what phase you're in, there are certain fundamental things that we've done that are not like it was in September and October. You want to call it the new normal, you can call it whatever you want,
But even if you are in phase 1, 2, 3, it's not okay, game over. It's not. It's going to be
Yeah, they're talking to him. Audience of one.
the way that we protect ourselves because, as we know, and as I've said from this podium, it may very well be, as we go the cycle around, that there'll be this virus that wants to come back to us. I think we're going to be able to handle that. Thank you.
Yeah, look at that. See him tapping Pence on the shoulder? They've worked on this strategy of how to talk Trump into this.
Go ahead, Dr. Fauci. Dr. Fauci, so I assume that there's also a phase 4, which is after a vaccine is developed and available to everybody.
No, don't talk about phase 4. That's a year and a half away, dummy.
So
Don't get it. Don't get him excited.
question on phase 3 being the new normal, are we during that
Oh, are we buffering again? I see it on mine.
phase going to be able to see things like
Oh, Twitch is down? That's what it is.
packed arenas
I never lost it on my side, so I'm not quite sure it's the internet.
for sporting
Yeah.
events, large crowds, concerts?
The answer is it is conceivable that we will be able to do that. I think there will always have to be attention to making sure that we don't do all that packing in together. I think we'll be able to have sports events in that phase where you
Thank you, Christine F.
actually have participants there. I'm not sure you're going to be able to do that uniformly and evenly temporally with everyone, but when people get to that phase, paying attention to the fact that if there is a rebound of any sort, that when you're in that phase, you can respond to that.
Yeah, they literally, that's exactly what's happening, Hillmax. They're just all like, look straight ahead. They know how to socially manipulate Trump at this point. They know when he's going to do something stupid, and they're all just stiff as a board trying to talk him into this.
Or you put it back and go in the
Syringe is full of propofol.
other way. So the flexibility is that there may be some setbacks. I mean, let's face it, this is uncharted water. There may be some setbacks that we may have to pull back a little and then go forward. But John, the direct answer to your question, I do see us getting more towards normal.
Mr. President? Mr. President, if you take a look at the gating criteria as outlined in these guidelines, there are
Do I have to do that? When do I have to start doing that? Look, they played the slides. I don't have to memorize this bullshit.
at least a handful of states, I just looked at the trend lines, Idaho, Wyoming, Hawaii, Montana, that look like they've already satisfied that gating criteria.
Right.
In your call with the governors this afternoon, did you hear back from any states who said, we're already there, we could start the process now?
I did. I heard from a number of governors that said they're in very good shape. I also heard not only from the call, but I heard from some of the governors previous, and I think you'll have some very good things to report over the next few days about
Yeah, nobody's going to Hawaii. They've locked down the island.
states opening.
Yeah, the ones that actually have physical borders, though, with the rest of the states, not so much. Maybe test. I don't know. Maybe.
And I think, John, having to do with your call on sports, depending on the area, depending where we're talking about, you're going to have large areas of our country where this has not been or has been totally eradicated. You'll be able to have the
Totally eradicated. Listen to him. Oh, it's buffering? Weird. Oh, yeah. It looks okay on my end. It's very strange. A little choppy. I'm not getting it from the other side, so it might be, oh, yeah. Bit rate's 32, 23. Oh, okay. 3 frames and 60. Oh, that's weird. Yeah, there's, I'm looking at my bit rate and it's dropping significantly. That's a internet issue. Curious.
full arenas. Now, with everything being said, a lot of great work has been done on vaccines, but you have a testing process. Therapeutics, likewise, we have a lot of great things happening therapeutically. That
Therapeutically.
will be a
Thank you, Templeton's a rat. Thank you, brother.
step further.
I would call you Great King Rat, but that's, which is one of my favorite Queen songs. But, as you do.
But in terms of sports, they'll probably start off. As you know, I spoke to the commissioners yesterday, almost, I guess, of every sport. And
He talked to the commissioners of every sport.
Many of them are
Duh.
going to be starting without the fans, so it'll be made for television. The good old days, made for television.
The good old days? No. Professional sports was never just shot without people. You remember back in Rome when the gladiators were just on television?
And it'll go that way, and then fans will start coming in. Maybe they'll be separated by 2 seats. And then ultimately, we want to have packed arenas. When the virus is gone, we're going to have packed arenas, and we're going to be back to enjoying sports the way they're supposed to be. And the same thing can be said for restaurants. So at a certain point in time, when the virus is gone, we're going to be back to normal.
Mr. President,
Please, go ahead.
Mr. President and the doctors, can you clarify then, is the 30-day period to stop the spread, are those mitigation efforts still in place, or have they been replaced by this new guidance?
Well, they're going to be in place to a large extent, and it also depends on the governors what they want to do. You have very different states. If you look at Montana,
Yeah, we certainly do.
Wyoming, North Dakota, that's a lot different than
Notice he didn't mention South Dakota.
New York. It's a lot different than New Jersey. So it's going to be
Very different than South Dakota.
dependent
No, it's exactly like South
on the
Dakota.
governor.
Except, we're not testing.
Recommending, as you see in the charts, we're recommending certain things. They'll be in place dependent on what the governor wants to do. If we see something wrong, we will be expressing
I don't know why the bitrate dip happened. I'm not getting any signals in my software. It's driving me crazy.
ourselves very strongly. Please.
Apologies.
Thank you, Mr. President. Does this mean that states such as Montana and Utah
That was a weird. I'm going to hold for a second. I just saw that dip, and that's not cool.
that already
There we go.
meet that gating period, will they be able to go to phase 1 as early as, say, tomorrow if the governor decides?
You're talking about those states that are in great shape already?
Yes.
They will be able to go literally tomorrow, yes, because they've met all of the guidelines.
They've got 14 days to meet phase 1. That's already been the plan.
If you go back, you're going back 14 days, you're going back even a month. And they have the ones that I'm thinking about, the ones that I've already spoken to governors about, they've met the.
Yeah, I don't know why the buffering again. I'm getting a dedicated denial of service attack. That's what's happening. Am I being destroyed? Thank you so much, Jill Carter.
Guidelines actually pretty long ago.
Mr. President, what's your message to those protesters we saw a lot in Michigan, but in other states that are saying that they are refusing to comply with the stay-at-home orders issued by governors and local officials? I mean, isn't it important for everybody to go along with this as we go through these phases?
Well, they've been.
Yeah, it's dipping in and out. I apologize. I'm not quite sure what's causing that. Like I said, it doesn't seem to be a software thing. It might be an internet issue. Curious that, isn't it? Am I gonna have to start going direct into YouTube just to cover on this thing? Aggravating. What are you doing? What are you doing? What are you doing, you weird little thing? Down in 9 frames, down up there again. That's so weird. Yeah. Sorry about that, guys. I think it's just the 5 o'clock dip. I think that's what it is. I think this is the 5 o'clock dip. I think it's, you know what I mean? The people that are, like, the internet's already taxed, and then a bunch of people come home from work at 5 o'clock or get off work at 5 o'clock.
Going through it a long time, John, and it's been a tough process for people. You know, I told you there's death and there's problems in staying at home too. It's not just, isn't it wonderful to stay at home? They're suffering. This country wasn't built on that principle. It was built on an exact opposite principle, actually.
Well, yeah, explain what the exact opposite principle of, what do you mean? It was built on dying of an infectious disease? We should have been wiped out. I mean, dying during the Spanish flu was part of the Constitution. Thank you, Rebecca.
And I watched in one particular state where they were They want to get back. They want to get back. They were very strict sanctions that were put on people. That was probably the most strict of all. But
No, they were normal. There's everywhere else.
I just think the American people have been incredible. When you look at John,
Yeah, but he's asking you about the protesters who aren't doing it.
you look at what they've done, when you look at what they've been through, when you look at all of the death and all of the problems.
Yeah, these aren't the people experiencing it. The people who have experienced the death and the problems are saying, stay home. And these assholes aren't, because it doesn't affect me. Who cares?
All of the sickness, when you look at what's happened, I just think the American people have been incredible.
Urge those protesters to listen to local authorities?
I think they're listening. I think they listen to me.
Yeah, they listen to you. That's why they're ignoring it. What?
They seem to be protesters that like me and respect this opinion, and my opinion is the same as just about all of the governors. They all want to open. Nobody wants to stay shut, but they want to open safely. So do I. But we have large sections of the country right now that can start thinking about opening. There'll be some mitigation, and they'll keep it going for a period of time, including masks, by the way, in areas that you wouldn't even think. I asked a question today. I said, why would they wear masks in Wyoming or Montana or
Yeah, diseases aren't contagious in Wyoming or Montana. Has this guy ever watched a Frontier movie?
North Dakota? And that's if somebody should come in from an area that isn't so successful in terms.
Isn't so successful. See, that's what it is, guys. You don't have a contagious disease that this asshole let ravage your area. You're just unsuccessful.
Of what they've done. So that will be a governor's choice, and we'll have no problem with it.
Governor's
Mr.
Choice
President, you
Awards.
spoke this afternoon with your new congressional advisory groups, 32 bipartisan members of the House, 65 bipartisan members of the Senate. One of the big topics was the fact that the Small Business Association loan pot of $350 billion has hit the cap. It's exhausted. There's nothing moving on the $250 billion to replenish it. What did you tell those bipartisan groups today about getting the move on to get some more money into the hands of small businesses?
So just for the viewers watching this or hearing you ask that question, exhausted is a good thing, not a bad thing. It went quick.
Exhausted is a good thing, not a bad thing. So if you're exhausted by all this, it's a good thing. I know you felt like being exhausted was bad, but your exhaustion is a sign.
It is so popular. The banks have been incredible,
It's so popular. Everybody is so excited about being unable to work.
including 4,000 community banks. 4,000. Most people didn't know you had that many banks. 4,000.
Yeah, we know. Why wouldn't we?
They want is people want to keep this going, and we're doing it to keep the small businesses open and to keep the workers paid. And we have a $250 billion request. The Democrats like it. The Republicans love it. And to be honest, I think something's going to be happening. I hope so, because this is a very popular program. It was really executed flawlessly. The first day they changed an application a little bit. But when you look at what Bank of America did and what Wells Fargo did and Citi and a lot of the banks, but when you look at what all of the community banks did, it's been really incredible. Well, we're negotiating with Democrats, and they should frankly approve it quickly. This is a great thing for our country. It's a great thing.
Yeah, just sign off on $2.5 billion for election security, and the thing would sail right through. Why the holdup? Why would you want to stop $250 billion worth of aid that you think is crucial so that just so that you could avoid having $2.5 billion in election protections?
For small business and for the workers, and we're having a hard time getting them to approve it. I think
Mark.
it's going to happen. It should
I
happen
missed that
really
one.
unanimously.
Oh, Monka.
They're trying to get things, and we're not too happy with what they're trying to get. Please go ahead.
First, could you just say which states specifically you guys think have hit the gating requirements at this
I'd
point?
rather not say that, but you'll be seeing it very soon. I mean, I'd rather have the governors be able to announce, and they're very proud of it. They've worked hard.
Because you want to blame them when it goes south.
Some are
They shouldn't have opened so soon. That was their problem, not
in an
mine.
area that's less susceptible, and some really
Less susceptible. There's no such thing as an area that's less susceptible.
was done, I think we can say, through talent. They really worked very hard.
Oh, so the states with fewer people in them are more talented than New York.
And, you know,
That's the issue.
we have some states that got too much credit for what they've done. Frankly, I could name you a couple of those too, and I could
Yeah, go for it.
name you a couple of them.
Go for it. Yeah, who got too much credit for the work they did?
And we have others that have
Who? New York now? Because Cuomo's been calling you out for being nuts?
credit that have done a phenomenal job.
And part of the guidance seems to sort of shift to states and companies the burden not just of additional testing and surveillance, but also this sort of new normal in which, you know, there's smaller crowds in restaurants and bars and
Well,
arenas.
that's not going to be normal. There's not going to be a new normal where somebody has been having for 25 years 158 seats in a restaurant, and now he's got 30 or he's got 60, because that wouldn't work. That's not normal. No, normal will be if he has the 158 or 68 seats, and that's going to happen, and it's going to happen relatively quickly, we hope. But that's our normal. Our normal is if you have 100,000 people in an Alabama football game, or 110,000 to be exact, we want 110,000 people there. We want every seat occupied. Normal is not going to be
Wait, 110,000 seats?
where you have a game with 50,000 people.
But to that
Okay.
point, I mean, best case scenario that happens in these states that are doing really well in a month. Obviously, for I think a lot of other states, it's going to be longer than that. So my question is, what is the federal government going to do to sort of help, especially companies, but states and local governments in those positions, to pay for an even longer extended?
We're going to be watching over. We're going to see that everything is working out smoothly. We're in very strong communication with the governors. We're going to be helping with testing. They're going to be doing the testing. It's got to be a localized thing, and it really has been since I've been involved, because
Well, yeah, because you've abdicated responsibility. It's amazing how the states are just on their own ever since I've been
came in
president.
and federal
I don't really give a shit about this stuff. Look, I have one job: pack the courts with conservative judges from a list by the Heritage Foundation, and then take a phone call from Putin and do what he wants me to do.
It's supposed to do testing of parking lots in the middle of a certain state that's 2,000 miles away. It's ridiculous.
Why is it ridiculous? They're Americans.
But
What, you're not a governor. You're not the governor of D.C.
the testing has been so incredible. Two things: testing and ventilators. Ventilators are really tough. They're very complex. They're very expensive. They're,
No, they're not. No. And if you had a maintenance contract in place like you were supposed to, you'd have more even to hand out.
very sophisticated machines. Some are unbelievably sophisticated. Well, we built, you saw General Motors
No, they're completely believably sophisticated.
yesterday. Thousands are being issued. We have 11 companies building them. We have not had one complaint in the last week and a half, which is certain.
No. You're just not on those calls, and Pence is telling you that they like it.
Don't forget, when they were calling because in 2 weeks and 4 weeks and 5 weeks, they're going to need ventilators, not because they need them right now.
And then you sent ventilators that were broken, and they went, hey, we need to stop going to that well. It's dry.
We're right on our counts, and nobody that wanted a ventilator didn't get a ventilator. Plus, we have additional, if there is a surge. We hope there's not going to be a surge at all. But we're
Yeah, hope's a
going to be
strategy.
able to build up the stockpiles of states who didn't have them, who should have had them.
No, they're not supposed to have this.
And we're also going to have a big stockpile in the federal government, and we'll be
Thank you, Karen.
able to help
Nice no-hate picture, by the way.
foreign countries that need help, because you have you have countries will never be able to build a ventilator. It's tough stuff. We're uniquely talented in the sense.
You'll have countries that will never be able to build a ventilator. It's tough stuff. Anybody remember the countries he was talking about sending ventilators to? Italy, Spain, and the UK. So they're just not capable of doing this?
That we can do things that nobody else can do.
That nobody else can do. Who's we?
We'll get right back to you, John. Peter.
Really? Then why are we flying stuff in from China and South Korea?
Back, Peter.
Thanks. So you said you didn't want to name the states that might be ready to go. Can you give us some, or maybe the experts, Dr. Birx and Dr. Fauci, give us some sense of how many yesterday? You said 29 states were in good shape. Do you think as many as 29?
Yeah, Peter, I think 29 states are in that ball game, not for opening, but I think they'll be able to open relatively soon.
Yeah, on the same time scale, Please allow yourself to continue to be manipulated by the people who actually know what the shit they're doing.
I think the remainder are just getting better. Look, New York, New Jersey are having very tough times.
So is Connecticut. What about the southern part of Georgia? How about South Dakota? How's South Dakota doing? How's Tennessee's numbers?
And they'll be there.
What's Louisiana's like?
They'll be there at some point, but they're not going to be one of the earlier states. They're going to be later, obviously. I just spoke with the governor of New Jersey. We just spoke with Mike and a couple of folks. We had a great talk with him. Phil is a terrific guy. He's working very hard. Democrat, but we get along. He's working very, very hard. I guess the fact that he's right next to this big, massive city where everybody...
Oh, that's why. Guys, we figured it out. See, I thought it was because New Jersey was just less talented than other states. Turns out it's because they're next to somebody who's untalented. They brought the wrong date to the party. Like, this part is...
Is very closely, they're together.
Oh, are they?
And New Jersey's been hit
What's Philly like? Because it's close to New Jersey.
unbelievably hard. As hard as...
No, believably. Believably. This is how contagion spreads. Why is believability even a frigging standard?
hard as anybody in the true sense, but they're doing a great job in New Jersey. But that doesn't mean, Peter, that doesn't mean that they're going to be opening next week. That's not one that's going to be. But we have a lot of states that, through location, through luck, and also through a lot of talent, we have states through a lot of talent are in a very good position, and they're getting ready to open.
What states are talented about this? Why is Wyoming more talented because it has fewer people in it? What are you talking about?
And over the next very short period of time, it's going to be up to the governors. We're going to work with them. We're going to help them. But it's going to be up to the governors. I think you're going to see quite a few states starting to open.
And if they have a bunch of dead people, it's going to be their fault, and it's not my problem. And I told them to, we told them to follow our guidelines. So,
and I call it a beautiful puzzle.
A beautiful puzzle. It's a beautiful puzzle, guys.
You have 50 pieces, all very different.
Oh my God, the puzzle that a 4-year-old does where they learn the states. That's the beautiful puzzle. Like, I thought this was going to be a complex analogy for a second, and now we're down to the big wooden America where you have the wooden states with little pegs on them. Oh my God.
But when it's all done, it's a mosaic. When it's all done, it's going to be I think, a very beautiful picture. And
It's going to be a very, when you put all the states together, it's like they belong as all part of one whole. I've really started to believe that.
very important is what Dr. Fauci said. It could be that sometime in the fall, there'll be some flare-ups. We're going to be in a great position with everything we've done and everything we've learned. This was something that nobody ever saw before.
Yeah, no, people have seen it before. They prepare for these kind of things.
Such contagion and very, very powerful. People don't.
Yeah, asymptomatic contagion. Tell me again about the influenza-like illnesses.
Realize, because we all probably have friends. I have a number of people that were just great people who were just decimated by what happened. Some are dead right now. They're dead. They went into a hospital. One called me. He said, "I tested positive." 4 days later, he was dead.
Uh-huh. Yeah, 4 days.
We got to open our country, though. We got to open it up right now because it's got to open. We got to get our economy back. 4 days later, he was dead.
Following day, after he said that, he was unconscious. So this is a tough deal. At the same time, some people got sniffles and they didn't even realize they had a problem.
Yeah, but they can pass it on to everyone else.
And they are supposedly immune. We're going to find out about that. Even that's a little bit...
Some of these people aren't even dead. I don't even believe that.
Because we don't know how long the immunity lasts. But, Peter, some states are in great shape.
About a year and a half.
And they're really in great shape to open. And I think you'll have quite a few states opening soon. And they're going to be very vigilant. They're going to be very careful.
And then 4 days later, they're going to call me and they're going to go in a coma the next day and be dead.
The public health. A lot of public health experts have said that this would be better done if there were comprehensive surveillance testing, which we're obviously not in position to do. I wonder if maybe Dr. Birx and Dr. Fauci could tell us whether they feel comfortable.
Dr. Fauci and I will do it together. I just wanted to, it's why I wanted to put up the syndromic and the influenza-like illness piece. Because what is key in this is the early alerts and getting in there before they even know they have a problem. And I think CDC has...
Before they even know they have a problems? Before they have a problem? Yeah, everybody knows they have a problem now. It's in every state.
Been remarkable in building these
Every state has at least 2,500 cases.
platforms, Dr. Redfield.
And the states where they're not doing social distancing, it has an R0 of 3.
Integrated them so they're all on the same website. If you look at COVID-19, if you go into cases, you can find all of the data. And the beauty of it is the states are used to utilizing that through flu season. So the testing and contact tracing, and Dr. Redfield will be putting people in every single state to make sure that CDC is standing beside the state and local health officials to make sure that all of those cases are immediately identified and contact traced. I think what's new and what's really critical is this constant sentinel surveillance for asymptomatic individuals in communities that we know are particularly vulnerable. And
We don't know who's vulnerable. 1 in 10 has no comorbidity. You have a 1 in 10 chance of going outside and catching something that will kill you right now. Are you going outside? 1 in 10.
that hasn't been done in flu before, and I think that's going to be the added dividend that's really focused on who is most vulnerable and how do we get the fastest alert by generally screening people without symptoms. So people who are just coming to the clinic will be screened for COVID-19. And we do have enough testing capacity to do both that surveillance piece as well as the
No, we don't.
diagnostic piece and contact tracing.
Just a follow-up. Did you want to say something? No, actually, people have gotten confused about that because in the beginning when we were focusing really on just mitigation and really trying to keep peaks down and trying to worry about ventilators and PPEs and things like that, when you get a little bit more grace period, you can start figuring out what is the penetrance of this virus in society. What are we missing in people who might be infected? What is the percentage of those people that are out there? That's going to inform us greatly for a number of things, including the level, once we prove that antibody test that you have is really protective, and we still don't know that yet, we're going to find that out, we may get a good feel of what the level of protection might be in society. But we don't know that yet. So it's going to give us information as to what the vulnerable areas are and how we need to respond. Remember, there's two types of things: antibody tests and tests for the diagnosis of who has the disease. One you need for contact tracing, the other you want to need for finding out what's in society. We're going to
and the one that the antibody test is how we get a functioning society back. Until we have that, it's nonsense. Secondly, we do not have 1 million tests to spare. What a bunch of bullshit.
both of those much, much better as we go in the next weeks and months. And by the time we get into the fall, I think we're going to be in pretty good shape.
Mr. President, on the small business loans. As we see a hotspot possibly developing, maybe not, but if we see a hotspot developing, we've learned a lot. We'll be able to suppress it, whack it. We'll be able to do
Whack it.
things that people weren't even thinking about because nobody's ever gone through this. And
No, you have absolute strategies for contagion. This is what happens when you get rid of the pandemic response team and you're just like, everything is amazing. Everything is like, I don't even know how this, who could have even saw this?
1917, they went through something that was similar, probably not as contagious, probably more powerful in certain other ways, but
We didn't have any of the medical interventions available to us at all back then. They didn't know it was upon them because there was no... People didn't have telephones in every house.
we are going to be
Like, it was a rarity.
able to suppress it, we think, and we're going to watch it very closely. We're going to be able to watch things very closely. Please.
Mr. President.
Yeah, Bob, please.
Yeah, you're going to watch things? You mean watch people die?
Thank you, Mr. President. I think what's really important is during this bringing people back to work and our economy back to work, and what's going to go back is that we're going to be very aggressively focused on early case recognition, isolation, and contact tracing.
We don't have enough tests to do that right now. We don't have enough tests to find out who has it currently.
In the event that we just went through, unfortunately, as we started, we were very capable of doing that when the initial cases all came from...
Yeah, we didn't have electron microscopes back in 1918. We weren't even aware of how the contagion worked.
China, all the way through January, all the way through to the end of February, we were able to identify cases early, the first 14, do the contacts, do the contact tracing, over 800 contacts. We identified that 2 of those contacts were actually infected. We were able to isolate them. We were able to contain the outbreak. We're about to enter a new phase of this where we're going back to containment. And mitigation is going to continue, as Dr. Birx and others have said. Some of the things that we've learned to do, we're going to continue. But the major thrust of how we're going to control and make sure that we continue to keep this nation open is early case recognition, isolation, and contact tracing.
Yeah. Guys, that's how they're going to do it. Early case recognition, recognition and contact tracing. They're gonna, you know, it's what they're gonna do is they're gonna have a prison, and all the prisoners will have a key, and there won't be any cameras on the gates, and they'll only be closed during certain times of the day. And the whole prison is full of murderers and rapists, but it should work out fine. And we're gonna slowly but surely let the neighborhood go back to letting their kids play just outside the fence late at night.
It's the fundamentals of public health. That's what we're going to do. You see, we have very good surveillance systems that are going to help us. As we see these cases sporadically across the country, we've got to jump on them with early diagnosis, isolation, and contact tracing. That's what CDC is going to continue to help.
Yeah, how do you do that with asymptomatic carriers unless you have large swath surveillance testing?
Build that capacity in the states across this nation.
Grow a mustache.
And one other thing, because we discussed this today with the senators, we had the congressmen and women. There'll be some areas of our country, wide open plains, wide open spaces, with not that many people, relatively speaking, where you're not going to have to do that. Senators were saying there is no reason to do that in certain states and certain areas.
You mean like South Dakota?
Have the wide open.
The wide open. That's what we call the middle states,
Other
the wide
cases
open. Out in the great wide open.
Be doing that. So we'll be
Sure you didn't think they said white open? Anyways.
following it. Largely that also will be a function of governors. They know their states. So largely that's going to be a function of governors. Yes.
Yeah, we're going to blame the governors if it fails.
I think you used the term clear
It's the pass the buck presidency.
scientific benchmarks on testing. And the main periscope that I think you guys are talking about is the ILL
Oh, hi, people on Periscope, by the way.
syndromic, as well as the surveillance and the sentinel testing.
Yeah.
Are you opening things up then without doing, I just want to be clear, are you opening things up without doing widespread testing? Is that because you don't
Yeah.
have the capacity or you don't think it's
We
necessary?
do have the capacity, but you have states without any problem. You have states with
How do you know unless you're testing?
few cases, and those few cases have healed. You have
They've healed. Oh, like the 11 cases initially and the 15 that was going to go to 0 and the one old lady?
states with very little death relative.
We're back to January. I swear to God. He's now just parroting January as if 30,000 people haven't died.
Speaking,
Hey, Boxy Mama.
as I said, one is too many, but you have states with very little, and frankly, they're at a point where they have almost nothing. So this is a much
Almost nothing. It's okay. Go say goodbye to grandmother. She was almost nothing.
different case than a New York or New Jersey, where they're going through, frankly, they go through hell. And if you look at New York, I'm looking at bed count, because you have to look at bed count, and it's really dropped. We built the Javits Center with 2,900 beds.
You had a friend you just talked about who called you one day, was in a coma the next day, and was dead 4 days later.
And it was I mean, they built it in
No intervention could save him.
4 days. They did an incredible job. The Army Corps of Engineers. It was not used very much. We sent the ship.
Yeah, because they sent most people who didn't need intervention to convalesce at home because it was safer for them.
Hospital ship in to New York Harbor, and it was not used. Then we went COVID, and it still was not used very much because the bed count has gone way down, way down.
In these states, when do you see yourself
Go
getting
ahead,
back
please.
to campaigning?
Mr. President.
Here you go.
I mean,
This is not campaigning. I want to make the country better. I don't care about campaigning. This is about making our country better. I think this team has been incredible. Whether it's Army Corps of Engineers, whether it's FEMA. One thing that happened on the call today that I noticed more than anything is
How nice everybody and how grateful they were, and how everyone was just kissing my ass left and right.
Gaynor. So many governors said, I want to thank you. Pete Gaynor called up. They had tornadoes in a big part of our country.
Which part was that? You mean Mississippi? The 2 F5s that went through there? It was a couple days ago. Can you remember?
This week. And
Sometime. When was it? Feels like 100 years ago.
they were all saying that he has been unbelievable. They called one after another. They were thanking us for, that's FEMA. And they were thanking us. No,
Thanking you for
I want to heal this country. This is a war. We've been through a war. We have an invisible as opposed to a visible enemy. I think in many ways the invisible enemy is much more dangerous, is much tougher.
Yeah, you mean the asymptomatic part of this invisible enemy? The one that you're not going to contact trace and you're not going to test sufficiently enough to limit? I mean...
In the G7 today, I went through country after country. We were there. We all get along great. Angela Merkel and Shinzo
And Shinzo Abe, he's got the list. Look, he went straight to the list.
Abe, Prime Minister of Japan, and all of them.
I know them very well. They're my favorite people. Let me peek on the sheet to make sure I don't screw up the names.
Their countries have been devastated by this. Their economies have been devastated by this. 184
No, Germany's doing better than we are.
countries all over the world. And we went through one after another. And I was angry because this should have been told to us. It should have been told to us early.
It's China and WHO's
It
fault.
should have been told to us a lot sooner. People
But I started it very early, and never mind the fact that most of the cases in New York City came from Europe.
knew it was happening, and people didn't want to talk about it. I don't know why, but we're going to get to the bottom of it. But people should have.
China, or I mean,
People. I'm not saying anything. I'm saying.
I'm not saying anything, I'm just saying.
People should have told us about this. They should have told the rest of the world.
We had our own people in there. We knew. We have surveillance. We have intelligence. You didn't listen to them.
When I looked
You're a big orange dummy.
at Germany talking today, when I looked at France talking today, the European Union was there represented. That represents a lot of countries. Their economies have been devastated.
Uh-huh.
But they're going to build them back. But we're going to build this economy back bigger, better, stronger than ever before. You watch. And we
No.
stimulus. And we're going to do things, whether it's infrastructure, which we would like to be able to do, our roads, our tunnels, our highways, our bridges. Our bridges need help. You know, a lot of you have reported on our bridges. A lot of bridges are in bad shape. They should have been fixed 25 years ago with this.
Uh-huh. And what party has been blocking infrastructure for the longest time? Let me think. Which one is it?
Still standing. They have to be fixed. So hopefully we'll get an infrastructure bill. The good news is the interest rate is close to zero. And zero interest is a good thing when it comes to rebuilding your infrastructure and your country back. Please, in the back.
Mr.
We
President,
need to go to OAN or Epoch Times. So glad to see you. We believe that the comet tail will be coming by, and we would like some ball hair to use as propellant.
walk us through the calendar, if you would. When it comes to Memorial Day or even Pentecost in May, you've got July 4th, Labor Day weekend. What would you anticipate at each of those milestones?
Well, I don't like to anticipate because you have a couple of
I don't like to anticipate, but I do think it would be a beautiful thing if we opened on Easter. Is Easter past? I don't really keep track of these
states
things.
that are in difficulty, that have made a lot of progress, by the way, and they're either here or they're heading down. But, so I'm not going to go in terms of dates, but I think we're
It's ridiculous.
going very quickly now. I really believe. I think we're going to have a lot of states open
No one cares what you think. Your opinion about stuff. Tell me more about hydroxychloroquine.
relatively soon.
Have
We're
we?
beating
Is
the
that
date. I
was that the game changer? Was it a miracle?
set a date of May
Yeah, he did say Pentecost.
first, and here we are. And I think you're going to have some nice surprises over the next few days, and that'll be before. And that's big stuff. Some of those states are big. They're big stuff. Big, very important states. And it's going to be added on. And as we look,
Okay.
I don't want anyone coming back that isn't in position to come back. The last thing we want is for, let's say, a New York to come back too soon, or a New Jersey to come back too soon. We want
But
them
the southern states, if a bunch of people there die, who really
to come
cares?
back when they're ready. But they're really heading in a good direction. And I think it'll be much faster than people think. I think it'll be quicker, but it's got to be safe. Yeah, please, Rebecca.
Thank you. Has the government modeled the possibility of what might happen, how many deaths might occur if there is a widespread resurgence? If this just doesn't work, I mean, how many deaths are we talking about?
So if we didn't do what we did, we were talking about up to 2.2 million
That you don't get credit for not doing anything, cokehead.
deaths. So that's 5 times almost what we lost in the Civil War. Okay?
But from here on
If everything happens properly, and if we continue to go the way we're going now, we will be significantly less than the lowest number with mitigation. So we'll be significantly less. And it's still a lot of people. One is too many, as I've said, one is too many. But we'll be under the number of 100,000, which was the minimum number projected by the model. And I give everybody up here, I give all of the people that we've been working. I mean, this was a military operation with a lot of private help.
No, it wasn't a military operation. This is like not even close.
If you look at Roche, they were incredible. Look at Johnson & Johnson now, what they're doing. They are very far advanced on a vaccine.
No, they're not. They're in a standard play. They're looking at September at the earliest date. That's still a second phase testing.
Therapeutically, we have some of these genius companies. They're truly genius companies. I'm seeing them. I'm meeting with the people that run the companies. And
I probably understand this more than they do.
And
I was like, guys, I don't know if you've heard about convalescent plasma. No one was even talking about that until I was president.
I mean, what they're doing is incredible. It's incredible. It's a beautiful thing to see. So I think we're very far advanced, and I think we're going to be in great shape soon.
Yeah, 33,000 dead Americans on top of the normal deaths.
Yeah, please.
Mr. President, I know you don't want to mention specific states, but what about Washington and California? Do you have guidance for?
Do you mean Washington State or Washington here?
Washington State and
Washington here.
California?
Well, that's going to be up to them. They're going to have to make that determination. I mean, the governor of Washington was saying that he can't find cotton because, a swab is a very easy thing to get. And swab is essentially, it's a little bit more sophisticated than a Q-tip.
Oh, do tell.
And you got to be able to go out and find. The federal government shouldn't be forced to
Forced into the swab business?
go and do everything. What we've done is incredible. What we've done are the ones that can't be done, like, for instance, the ventilators that can't be done by anybody but a very powerful, very great manufacturing country, which is what we are and what we're really getting to be. And I have to tell you, some of these companies, what the job they've done, and we're going to recognize them pretty soon. The job
Really? You're going to read off their names again? Are we going to gather them?
they've done in terms of getting out, in particular, ventilators, because ventilators are so hard.
They're so hard. You wouldn't believe. We worked so hard on ventilators that now everybody, like, how many open source ventilator things have you seen in the last week and a half? There's a $500 one that runs on your phone.
They're so, I say, and some people say, oh, it's not really as complicated. Well, it's like building a car.
No, it's not like building a car. It's like building a ventilator.
And you know what? The price is the same, too. It's a
No, it isn't.
very expensive thing for
No, it isn't.
a sophisticated ventilator. It's very, very tough stuff. Yeah, please.
Mr. President, let me toss this question.
The worst part is when you have to get insurance.
To you.
You have to get collision.
And to the doctors as well. Truthfully, for those states that aren't ready to go to phase 1, to get through these phases, do we have an idea of how many millions, tens of millions of tests they're going to need for them to get through these phases? Any number out there? Tests of any sort?
I don't think we need any more tests. We got too many tests to begin with. Testing's a mistake.
Yeah, so I mean,
Yeah, so testing is not part of the big deal. Right now, what we're really looking at is if everyone can just wear a scarf and cover their face.
you've heard me talk about tests for a while from the podium, and I think
And it still hasn't made sense.
what has happened
Because you keep telling us we have plenty or too many. Look at him.
over the last several weeks is
He farted again. You can tell he cuts his
hospitals
jacket.
and clinics that could move to
Cheers, Helveck. Be well.
the more point of care test, move to those point of care tests. And what it's left is an amazing array of capacity that exists in the country for at least 1 million more tests per week. So we have a whole team working lab by lab to see what it would take to turn on all of those labs that aren't running the pieces of equipment now. So you see in the system, I just said to you that
Because why? Because they're doing other stuff?
1 million
You're talking about commandeering labs to do your job for you?
more tests per week, that we have tests sitting there and equipment sitting there, and now we have to really deal with each single lab to really figure out what they need. And I just want to thank Administrator Verma, Seema Verma, who went through with us, and thanks to the lab directors, they really explained to us highly technical difficulty to run some of these big pieces of equipment, because you have to aliquot the samples, you have to centrifuge, you have to put them on the machine. Takes a tech full time. At $50 a test, it wasn't enough to hire another technician to run the machine full time. So at $100 a test, it is. So those are the kinds of changes we
$100 a test.
have to make bit by bit by bit. But that alone doubles our
One at a time? What stages is she talking about?
testing capacity per week. So we're committed to work with laboratories to answer every one of their issues with the state and local governments. And I think, frankly, every conversation I have, and the governors will say, I need 5,000 people tested. And I say, well, at the University of X, there are 6,700 tests waiting for you. So
67. Okay, listen to this, though. Here's where the truth slips out. There's 6,700 tests sitting.
it's more of making sure that every governor and every public health official knows exactly where every lab is and where the tests are, so we can create with them a real understanding so all these tests can be run. So yes, there is twice the capacity right now.
Twice the capacity. We need 50 times the capacity currently?
So just so you understand, excuse me, just so you understand, we have tremendous testing capacity. You look at the labs, they're actually saying, send us. And the reason.
No, they're not. They're saying double the price and we'll hire another worker. And that twice as many tests from a lab that's only doing 6,000 tests a week? How much is this going to cost? What's the price tag?
Down is because we have so many other tests that frankly are easier because you don't have to send. They're on site. And now.
Yeah, and they take 15 minutes. And if you did everybody at a hospital that you have to do again tomorrow, nobody would go to work.
We have the new saliva test that just came out yesterday, which is probably the easiest of them all when you get right down to it. And I was seeing where Rutgers is involved.
It's not easy. How you get the sample is not the deal. How long does it take to process? How many can you process at once?
Oh, great school, great.
These on-site single tests that take 15 minutes or even 5 minutes, when you've got 100 staffers at a hospital and you need to retest them again
College.
every day.
Great university. And they're using that. So many people are going to want to use that. But they don't have to use the labs anymore. Labs are great, highly accurate, very, very great companies. But they're down. They have tremendous, as that goes down, you have additional capacity. We have tremendous testing capacity.
What do you mean by capacity? We're not using it.
And to think that a month and a half ago, we had virtually nothing.
A month and a half ago. Do you really want to go there? Do we really want to dial this back to what you were doing in
To
February?
conclude, we're opening up our great country again. It's going to be over a period of time. We're working with some really great people, people that have become friends of mine, and I'm including Democrat.
How magnanimous. I mean, honestly, guys, we were just, I mean, you have to know that it's, it just takes so much. He's that good as a person. Oh, thanks for that, the Super Hearts. I finally got to see one. That was amazing. Thanks for the Super Hearts on Periscope, you guys. And thanks to all the trolls in Periscope who moved over from Facebook for bumping my numbers up. I appreciate it, guys. Thanks. I think that's important.
Governors that have really done a good job, Republican governors, most of whom I've known that have done a really good job. They're all working together. We're all for it. With few exceptions, the relationship has been outstanding. And I want to thank Dr. and Mike.
Doctor, glad I'm not sick.
I thank the director. Fantastic job. We've all done, by the way.
Love you too, Krista. Thank you.
The FDA, he has
Thanks, Slick Chick.
broken hurdles that years ago, even recently, would have taken years. He got one thing done in one day that would have taken 2 years for some.
Why? We're in a pandemic. Why would it take 2 years? You know why it takes 2 years normally? So we know it doesn't kill people. But when you're in an emergency, you don't normally, like, we've gotten approval for all tracheotomies to be done with a pocket knife and a big pen. That would have taken years.
Anybody else? So I want to thank Dr. Hahn of the FDA.
What's your vector, Victor?
We have incredible people that we're working with, and we're going to bring our country back, and it's going to be bigger and better and stronger than ever before. We have learned a lot. We've learned a lot about ourselves.
Yeah, we've learned that if we stay home, we can stop a disease from spreading.
I want to thank
And not to listen to you, and governors are on their own. And if they fail, it's not your fault.
everybody, and most
And the buck stops with sort of Pence, but mostly Burks.
importantly, I want to thank the American people. Thank you all very much.
Oh, I feel thanked.
Quick question on grocery stores.
Oh, they're just packing up and leaving.
Kroger grocery stores asked grocery personnel to be classified as secondary first responders or emergency personnel so they can get access to testing. Is that something that the federal government will be open to? We're working with all of our.
We're working on that. We're going to think about that. Let me think about doing something where we think about doing something.
Okay.
Good Lord. What a mess. Thank you guys for hanging in there. I appreciate it. We soldiered through. We made it through another one. And we've all learned a valuable lesson, I think. Hold on. I'm going to get in trouble because I figured out while this was going on what the hang-up was visually, why we're having data issues. So, yeah. It was because I kept moving the chat around. OBS cannot handle it when you create a shot on the fly, as we will see in a second when it jams up for a couple of frames and gets weird. So there you go. Doctor. We'd like to thank Doctor for giving me the news. I do have a bad case of loving you. No pills going to cure my ills. Doctor. This is like the Heil Hitlers in Jojo Rabbit. Patreons assemble. That's right, Richard Custer. Thank you, brother. I appreciate that. I hope you're doing well. Hope you're holding everybody doing good. Sound off. Where are you guys in the in and about the country? Let me know. Tell me. Thank you, Joyce. I got to stretch this out, but it's going to be slightly better. Yeah, see, it drops down. That's what the buffering does. Figured it out. Thanks, Richie Munster. Look at that. Holy smokes. And thanks for the super hearts. Major. Doctor. Hi, brother. Check COD. Oh, check Call of Duty, or the check is in the mail. Minneapolis, Memphis, Tennessee, San Francisco Bay Area. Be safe around there as well. Lupe in Chicago, and Connie, you guys are in the same neighborhood. Jacqueline, are we straight up French Canadian? Jacqueline in French in Canada. Hi, Adriana, in Northwest Indiana. All right. Rockville, Maryland. There you go. Oh, wow, you tart. Wow. Gotcha. Okay, good. Patreon in South Florida. That's right, Jeff Nine Cow. Thank you, brother. I appreciate you posting the link. I saw that a couple of times, and I greatly appreciated it. Boxing Mama, you're in Ireland as well? Well, fantastic. Get some rest. I wish you well. And one day, when you're on, I'll tell you my Colin Farrell story. How about that? Guess where I'm from? Philly. I'm going to go with Philly. There you go. Mahomet, Illinois. Excellent. Chelsea, Michigan. So you guys got a lot of, what an amazing contribution you are. Thanks. I am not my thoughts. I do my best. Oh, you sent a Call of Duty invite. Excellent. I will. That's amazing. Yay. I might actually have someone to play with. I feel like a real boy now. Richard, that's lovely. That's fantastic. Battle Creek, Michigan. I've always loved the sound of that place. Elk Grove. All right, there you go. My mom was from Brussels, hence Jacqueline, I'm from Vancouver. My Aunt Sophie was from Brussels. She spoke French, not Finnish. But there you go. Boca Raton. All right. I'll be down in Florida after this is all straightened out. Thanks, I got some bud for that sheet metal plate I measured earlier and made. Nice. Worcester. Nice. What's up, Worcester? You guys are amazing. Appreciate your support today. Thank you guys for being patrons. This is only possible because of you guys. I greatly appreciate it. And thank you guys for the super chats and the super hearts today and all the super everything. You guys are just super. Some of you, and I know I've said this before, are super powerful people. So there you go. I need to work on another screen for this because I think what jacks up the stream, the bit rate, is if I try to modify the screen live in my setup screen because I can transition from the edit to the live window. When I do that, it seriously freaks out OBS. That's what was causing it. Stephanie Miller worked in our city. Oh, is she on the air there? Yeah. Tell us about Colin Farrell. Oh, I will. I'll save it up. We'll do this on a non-regular stream. I learned a lot about social dynamics from Colin Farrell. That's all I'm saying. Love you too, Joe Carter. Thank you guys so much. You guys have been amazing. Yeah, the dead ones lack talent. I don't know what that was about. Some places are more talented than other states for not having stuff. How many screens are you rocking at once, Hal? 3. I have my laptop and the monitor that I have running off that needs the space on it. And then my old computer I use to run Restream so that I don't double up the video card that's really doing all the output on the laptop. Thank you, Rob Glenn. So yeah, we'll talk to you guys soon. You guys are awesome. I'll be back on working on this setup a little bit later. I've got a couple pages. And we will figure out at some point, I'll have all my kind of dialed in pages. But does this look okay for you guys when it does work? This is a functional use of your time. I don't like this. This is ugly, so that's what I have to fix. I need a chat window for you guys. So I'm going to work on that next. So yeah, I just have to do it when I'm not online because it freaks out apparently. That was the lesson learned today about OBS. Use a powerful GPU. The one built into my laptop is really strong. It's just I had switched to the hardware encoder yesterday, back to the software encoder today, and it worked much smoother. It just can't. The software itself just can't handle it. It's not even about the GPU. It just won't. Oh yeah, the tip jar. I got to put the tip jar back. That's a great point, John. Excellent. I will have the tip jar back the next time you see me. But you guys are fantastic. I'm going to sign off. Rest well, get some food in you, feel good, and I will talk to you guys later. Okay, bye. I'm don't know why this is working or if it's not. There we go. Hold on.